Hello, and welcome to Dementia Prevention presentation. New research has shown that there are 12 life course risk factors that can be modified, and we might be able to prevent or delay 40% of dementias. That's just remarkable. Education early in life, then in the middle age, hypertension, hearing deficit, and obesity. And then after the age of 60, physical inactivity, diabetes, depression, social isolation, and smoking have been proven as early as in 2017. And then in the last 3 years, we know now that there is solid evidence for head injury, excessive alcohol consumption, and air pollution as modifiable risk factors. In the future, we might see other risk factors such as chronic gum disease, obstructive sleep apnea, and chronic stress rising to the level of established risk factors for dementia. Also, we need to recognize protective factors such as regular, vigorous physical exercise, brisk walking program, genetic factors such as ApoE2. Mind you, ApoE4 is a risk factor for Alzheimer's disease, especially 2 copies, whereas ApoE2 gene can be protective. And then we know that Mediterranean diet and DASH diet, dietary approaches to stop hypertension, have been shown to reduce the risk of dementia in the future. And the combination of this diet is now called MIND diet, M-I-N-D. Check it out. New research has also shown that when some of these modifiable risk factors have been addressed over the last 2 to 3 decades, we have seen a drop in the prevalence of dementia, a 13% drop every 10 years since 1988. And the drop is even more in men than women, primarily because women were already doing very good in controlling their cardiovascular risk factors. And in the last 3 decades, men have been starting to do better in terms of managing their hypertension, high cholesterol, smoking, etc. It's important to also recognize that we can now assess risk for Alzheimer's disease by doing very fancy brain scans such as amyloid imaging. But to disclose Alzheimer's risk needs to be done very carefully and have a rigorous process in place. Otherwise, we could cause harm such as anxiety and depression. I recommend the MINGLE approach. It's just a fancy acronym to prevention of dementia. M stands for mindset. It's important to have a positive, proactive mindset. I stands for iatrogenicity. For example, we need high quality medical care, and there are a lot of medications that can cause memory loss. We need to avoid that. Nutritional strategies, tracking genetics and biomarkers, lifestyle modification, and environmental risk factors such as air pollution and other environmental toxins need to be addressed together if we are to influence our own future risk of dementia. I recommend the book by my mentor, Dr. George Grossberg, and myself, Psychiatric Consultation in Long-Term Care. We have a chapter on dementias, major neurocognitive disorders. We have information on brain wellness program. We have list of medicines that can cause memory problems. And then the book written by myself and my wife, One Day Mindfulness Millionaire, where again, you will have a lot of tips to manage stress better, improve your relationship, and also reduce your risk of dementias. Hope this has been helpful. Namaste.